Good afternoon, everyone. How are you all doing today?
Good.
Good. Wonderful. Last week we had Dean Gilliberti come in and he talked to us about academic planning and success here at Rutgers. So, does anyone have any questions about that? No? Awesome. So, today we're going to also be talking about success, but not academically, but we're going to be talking about it professionally and in terms of the healthcare setting and cultural competency. So, being future healthcare providers, whether that's physical therapists, occupational therapists, physician's assistants, or even medical doctors, you'll be working with people from different social, economic, and racial backgrounds. And connecting and building trust is one of the big parts to the healthcare practitioner patient relationship. So one of the best things I've learned here at Rutgers is that it's such a diverse place, and you can learn so much about different backgrounds and cultures. And it's a great opportunity, but you just have to put the effort into going out and really, implementing yourself with different people. So with that in mind, let me tell you a story about my experience with cultural competency in the medical field. For the past couple of years, I've been working at a physical therapy clinic in my hometown. And during my early visits, I had a patient by the name of Eugene, and he was a stroke victim who was also going through occupational therapy and speech therapy as well as physical therapy. And his speech was jumbled, fragmented, and sometimes you plain just couldn't understand him at all. And it was really hard to understand him. And it created a barrier between himself and everyone else in the physical therapy clinic. I was really uncomfortable with the fact that I couldn't understand him and I couldn't hold any type of conversation with him. And frankly, I got frustrated sometimes due to the fact that I really couldn't have a talk with this man. I couldn't say anything to him and I couldn't understand what he was saying either. Over time, though, I began to understand him little by little, baby steps. And at one point, I was finally able to have a real, albeit very, very short, conversation with him. And I felt so amazing after that. And I could see from his side that his temperament also improves when he came into the clinic to do his exercises. So, from his point of view, he was probably also getting frustrated with the fact that he really couldn't communicate with anyone in the clinic. And I think it was good to see him, or it was good that he saw me trying to interact with him, hold conversations with him. And I think that's why his temperament improved as well. So the moral of this story is to not shy away from these uncomfortable situations you might have when you're shadowing in the medical field, but to rather fully embrace them. And you don't want to shy away from these opportunities because in the future, you'll have your own patients that will also have these different types of barriers, and you'll want to be able to interact with them as well. So earlier is better than never. That's always what I say. So because of Eugene's lack of balance and strength due to his stroke, he had a huge, huge fear of falling. And for him to regain his balance and strength, the physical therapist had him do several different exercises. And seeing them was one of the most interesting parts of being with Eugene and seeing him improve. So we're going to do some of the exercises he did. Isn't that wonderful? All right. So the first exercise we did now, which is perfect. So the first exercise we did, he was sitting down. Hopefully everyone can see me. Thumbs up, thumbs up. Wonderful. All right, so the first exercise you did, you can do it with me if you like. So they were called seated marches. And basically, you just bring your knee up to your chest. All right. I know I can't see everyone's legs, but all right, awesome. And then basically we would alternate which legs he did. So this really helps with his hip flexors, strengthening them. And it would also help with him walking and specifically walking up and down stairs. just to regain strength in the hip flexors. All right, so he would do several sets of 10 each of this exercise. So the second exercise we did were called ball circles. So everyone has their ball or circular object. Awesome. So he would hold the ball with two hands, and basically he would just go around in a circle. So he would have his non-affected arm guide his affected arm from the stroke, and this would really strengthen his deltoids, especially his biceps. So he would do a couple of rotations of these and then go around the other way as well. All right, looks like everyone's doing them well. Great workout today. And so the last thing we did, a slew of different balancing exercises because you know you can never do too many of those. So the physical therapist actually had him stand up, and he would either be standing on hard floor or even a foam pad for challenges. And so he would have the physical therapist would have him stand, and sometimes they would have him close his eyes. And because balance is mainly based on your eyesight, in case you didn't know that. And so by closing your eyes, Eugene would have to use his vestibular system, which is the inner ear filled with fluid. And he would have to shift his weight, and he would have to use proprioceptors, also known as sensory receptors in his legs, to really feel the weight shifting. So I don't know if any of y'all want to do that right now. Stand up and try shifting your weight with your eyes open and then your eyes closed just to try it out. And maybe you can tell me which one's harder to do.
It's so much harder with your eyes closed. Like it's a very funny feeling.
I how hard it is.
Yeah, so basically that's why, because we're usually using our eyesight for balance and looking at a horizon, but without that horizon, we have to rely on our bodily systems, and they're not always as good as our vision because we rely on it so heavily. So these exercises really helped Eugene regain some of the balance and strength he lost after his stroke. And so while he did his exercises, we were able to talk, and it felt amazing being able to understand him and see him improve over time. Unfortunately, other patients in the same situation as Eugene around the world, especially in the US, do not get to have the same amount of success Eugene and I had due to a lack of cultural competency on the healthcare practitioner side. So with that in mind, we're going to now read an article about the lack of cultural competency in the healthcare field. So, all right, we're back, and we're just going to pull this up. And so I'm just going to go through it. I'm not going to read it out loud, but just give me a thumbs up when you get to the last sentence you can read, and then I'll scroll down a bit further. Everyone okay with that? Awesome, awesome. All right, I see a couple of thumbs up. He has one, right? All right, so I'm just going to scroll down. And while you're reading this, just be sure to, jot down or just make a few mental notes of some of the big ideas you're reading about. All right, I got 2, 3, 4. All right, scrolling down. All right, I got 2, 3, 4. Swathi, do we have a thumbs up over there? Yes, we do. All right, scrolling down. All right, looks like we're all good. So I'll scroll down a little more. All right, we got a couple of thumbs up. We got 3 thumbs up. We got 4 thumbs up. All right, perfect. All right, perfect. Scrolling down some more. What the world is that? Oh, I can't tell if Grace is just touching. Oh, okay, we got a thumbs up. All right, perfect. All right, the good news is I think we're almost done. So good job, everybody. All right, awesome. And All right. And okay, so we'll just read until that last paragraph there. Even though it says deepen your impact as a nurse, this can also relate to all different kinds of careers in the medical field. It doesn't specifically it doesn't specifically have to just be about a nurse, but just any type of career as well. And just give me a final thumbs up when you're done. All right. And all right, perfect. So get out of the screen share so I can see everyone's beautiful face. All right, so we're just gonna have a little bit of a discussion here about the article. So just to start it off, what did you think the main thesis of the article was? And if you could just give a mini summary of it, that would be awesome. Anyone wanna go? Don't all jump at once, please.
Was talking about the importance of diversifying the healthcare field, but also being prepared to work with diverse patients.
Okay, awesome, great point. Anyone want to add on to that?
I think it also was referring to how increased cultural competency will benefit people in a more equitable, it'll allow for a more equitable treatment, but also it'll benefit the doctors as well by exposing them to more diverse kinds of medical backgrounds.
Yeah, no, that's a great point. So what I really pulled from it is that especially minority patients, they appear to suffer more than their white counterparts due to a lack of cultural competency on the practitioner side. So that's really a big thing I pulled from it. Does anyone else want to add anything else? All right. So why is it important for a healthcare professional to be culturally competent? Yes, Swati.
So they can treat patients who have like a diverse needs. Like obviously if certain diseases are sort of, for example, like contained within a certain ethnic population, and patient or doctors who don't have exposure to different like cultures or different ethnicities won't have exposure to certain genetic disorders or conditions.
Yeah, no, that's a great point you bring up there, especially with having different diseases that may come from different cultures. So sickle cell blood disease is usually found in terms of African populations. And because if you're never exposed to that, and let's just say hypothetically a doctor does go without that information, they'll just be stumped as to what it is, and they'll be unable to provide the necessary treatment because they'll just be guessing at what the patient's problem is. So anyone else want to add anything else? Susan.
The article was saying that like minority populations often feel they're getting better health care, or they're more satisfied with their health care when they see a professional that looks like them. And so like that's interesting, but then it also makes me think that I can't possibly look like everybody, but I think the reason that they like being treated by people that look like them or come from similar backgrounds is they feel understood. So while I can't look like everybody, I have to work hard to make sure I'm understanding who my patients are. And so developing a stronger sense of cultural competence can help me work better with people that look different from me, I think.
Yeah, no, that's a great point you bring up with the understanding, because that's what everyone wants to feel in this day and age, is to be able to be understood by others, especially healthcare providers who in some situations have their lives on the line. So understanding is a big key. Topher, I saw your hand raised. Would you like to share?
Sure. I was just going to say, like, as a doctor or any sort of healthcare practitioner, you take like that Hippocratic oath, which I don't remember exactly what it is, but it's something like do no harm and like help all people, right? And so if you think about it in terms of other professions, like a mechanic doesn't, for most mechanics, they don't only know how to work on Ford or Chevy or Subaru or Jeep. They know how to work on all vehicles. And I'm not comparing healthcare people to mechanics, but like you want to be able to serve and help everybody, right? That's why you would want to work in that field.
That's a great anecdote you bring up there. I really enjoyed that one. I'll probably use that one for future use now, Topher. So thank you for that. So how would you try and introduce more cultural competency in the healthcare field? Any ideas?
I think that if you have like a private practice, to have like a large private practice and to make sure you have like a diverse group of people in it, because that way, like, you have a better chance of having patients of diverse backgrounds come because they may see someone who they identify with and feel more comfortable coming to that practice and then meeting other physicians through that. I suppose that would be one step. And then maybe furthering education on the kinds of maybe genetic disorders that would affect different ethnic groups, like for Ashkenazi Jews, like Tay-Sachs or sickle cell anemia, as we mentioned earlier. Like there's so many diseases of that nature, and physicians may be more accustomed to treating one than the other because of the patients that come to them, and like I guess sharing that information effectively to allow everyone to treat it just as well would be a good way to increase cultural competency.
That's a great point. Yes, Swathi.
I think also just like learning the languages is like super important. I like and a lot of the healthcare experiences I've had, whether that's been at like Robert Wood Johnson or as an EMT or like at other hospitals, I've definitely encountered patients at least once where um they just couldn't speak English. At Robert Wood Johnson, there were a lot of like Hispanic patients who couldn't speak English, and luckily I do know some Spanish and I can actually understand it pretty well. So like I was able to communicate with them. But there was another hospital I volunteered at. It was like JFK, when I was doing my like EMT like clinical hours, and I had a patient who was also Indian, but we didn't speak the same language. And I had a lot of nurses come up to me and be like, "Can you speak to him? Can you talk to him?" And I'm like, "I'm sorry, like I don't speak the same language as him. Like I don't know how to communicate with him." And none of the nurses knew how to communicate with him. So it was a very clear issue that they um, sort of lacked, I think, one cultural competency because they just didn't know how to sort of assess like the patient's needs based on his background, and also they just didn't have a diverse sort of workforce. Um, so yeah, super important to have that.
Yeah, maybe in that situation too, it would be an issue of maybe having some type of translator on emergency speed dial, just so that like you can actually interact and communicate with different patients of different backgrounds. So it's just not oh, we don't know how to communicate with them, so we can't give them medical services. It's more like, okay, how do we fix this problem? And how can we communicate with him? How can he understand us? And just, I know Swathi started, or she really explained that her own personal situation with cultural competency in the medical field. So anyone else, this doesn't have to be medical field related, or it can go back to your high school days. But is there any personal experience of trust and or competency you've had in your own life, growing up, high school days?
My this feels like sort of related, but my grandmother lives with us and is hard of hearing, like extremely hard of hearing. And so my mom goes with her to all of her medical appointments, and it's so important that she has somebody there with her because she could miss a lot of what the doctors are saying about serious conditions when you're older if you don't have someone there with you to help make sure your questions are answered and that you actually remember and can like take in all that information. So that feels relevant here too.
Yeah, and just want to reiterate the point. Different barriers for cultural competency aren't just based on racial or socioeconomic backgrounds, but it can also be like hearing or vision. It doesn't just have to be some type of like it can be any type of barrier. So that's definitely one of those, and the same with Eugene, because it wasn't a cultural barrier we had with each other, but it was more of an ability barrier that we had or he had. Would anyone else like to share? No? All right, so thank you all for sharing very much. And so as you can see, our country is becoming more diverse every year. So the need for cultural competency is becoming more and more necessary within the world, and especially in the US. So let's go over a few example populations of people you might meet as a healthcare professional.